We are officially a go, and I am seeing patients along with Ellie Stokey for it's family practice care. So it's a membership model. You'll see it around the country. Not a whole heck of a lot in Iowa yet, but the cool thing about it is you have more time with your physician, your provider. And so it's a non-rushed visit. There are unlimited visits in. We really work hard to get you in quickly, so there's not these long waits to get in for these visits for cumulative problems that are building up. Some people still may choose to hold on to their health insurance for the emergency purposes of it, if you have to go to the ER or surgeries, that kind of thing. But it's kind of like having a gym membership, and you come into the clinic and you will absolutely be taken care of so well, and we will work you through that wellness journey with the toolkit that we talk about all the time. So we have, you'll have a 10% discount for hyperbaric dives or hyperbaric treatments for those members, and there'll be other perks that come along with it for the other services in the clinic. Throughout the year, we'll run specials. But this Thursday, I'll have a question and answer session at our clinic from 5 to 7 p.m. if you want to show up. We'll give you a little tour of the clinic and field any questions that you may have related to the direct primary care. So, very exciting. This has been a long time in the works. We got our hyperbarics launched first, and a lot of the other parts of our integrative practice together, the functional medicine part, and but it all works together, and we've got the team approach on this wellness journey, and so excited to have our team be an option for you. I'd like to think of it as you have us in your back pocket. I got a call on Saturday night from somebody that was questioning going to the emergency room, and he gave me a call, and I was able to walk him through that, and there's a lot of comfort in that, to have more access availability to providers to circumvent potential visits to the ER, so on and so forth.
So I've been telling a story this week about a gentleman. I read it online, and so he's a family of 3, husband, wife, child. They pay over $2,000 a month in health insurance, and their deductible is $4,800 per individual. And he brought it up in a political sense, and I don't need you to get political here, but he said, I'm out there trying to do this right every day. I'm paying over $2,000 a month on my health insurance, $4,800 deductible per child, and you can be an illegal alien in this country and we'll treat you for nothing. It doesn't seem right.
Yeah.
So is this a way that guy who's out there paying $2,000 a month and a $4,800 deductible might get some help?
Yes. So for those that don't have insurance, this is a great option. For those that are looking to find, that person may be better off finding a high deductible plan and doing this direct primary care, where it's, again, 90 to 95% of his medical needs are met throughout the year for a monthly membership. And for our individual, it's $99 a month. For a couple, it's $179 a month. And so you just kind of build that into the budget, and that is a whole heck of a lot cheaper than that $2,000 plus that sometimes we're spending plus deductible per month.
Yeah, absolutely.
It's 3305 Burquist Avenue in Spirit Lake is the clinic, and it's right in the building just north of Ace Hardware, and so off of 71 there on the north and south. So the other interesting part of that, when you do come in, we'll field questions about the HSAs and some of these health. There's programs out there like Good Samaritan as well that pair nicely with direct primary care. So lots of things to discuss, lots of questions to answer, even like people that have Medicare. Can you be a part of the membership? Absolutely. You can be part of the membership, and then we hold on to that Medicare if we need to write off a prescription or you need to get imaging studies done. That would then be run through your insurance. So, but it's just a nice way. One thing, Dave, a story that I always like to share is it's the frustration of the patient and the doctor as we've developed these electronic medical records over the years is quality measures, and insurance companies are dictating to doctors what needs to be done in a visit. And so unless the doctors put this into the visit and ask questions that don't always make medical sense to the physician, and they're actually quite interruptive, they can take a lot of time. So we're sitting there meeting check boxes for the insurance company in order to get reimbursed for the insurance company. So this frees the physician up, the provider up at our clinic, to not be beholden to the insurance company, which is dictating what needs to be done in that visit. What needs to be done in that visit should be the decision between the physician and the patient.
All right, we're running out of time here, so you have a little hope story to tell us about a gentleman that evidently has found a younger version of his bride.
Absolutely. He shared a couple of weeks ago that he's getting his wife back, and she is working on a memory recovery, and she's in about 15 to 20 treatments of the hyperbarics right now, so sitting in these tents in our office in our clinic, and it's a cumulative effect. A lot of times you have to do multiple treatments with these for these chronic conditions such as memory support, dementia, and they kind of build these. Some people will get a experience of increased energy after one hyperbaric treatment or improvement in pain. But if you're talking about a chronic condition like the memory support, a lot of times that builds up over a course of 20 to 40 treatments. But so exciting for him. He indeed said, I'm getting my wife back, and the other big thing that he shared was that she is more engaged in the events, that she is, conversations with friends. A lot of times with memory loss, our loved ones will pull back and stop engaging in conversation. And it's the other way around now for her. She's engaging more. So she's another hopeful story.
So I want to talk about that cumulative effect just real briefly. So if you did a treatment a week, mm-hmm. you would have a cumulative effect over weeks. Okay, it would be like, let's use the example of, let's pour a glass of water into a bucket. Mm-hmm. Okay, every week you pour a glass of water into a bucket. Sooner or later the bucket's going to get full. Mm-hmm. But if you went 2 or 3 times a week, if you're talking about one of those chronic conditions, okay, each time you go in, you're pouring a glass into the bucket. That cumulative effect you will gain faster if you go more, if it looks like you're going to need a substantial amount of treatment.
Correct. A lot of times you'll eventually get there. It'll just be slower. Mm-hmm. And so you're getting there faster the more that you can accumulate the first 20 to 30 treatments for these chronic conditions. That's where I have some people that are, will do anywhere from 2 to 10 a week. So some folks are really motivated. They've had some COVID long haul problems. I got a gentleman coming from Sioux Falls right now that he's doing anywhere from 5 to, I think he's about 5 treatments a week. But that's saying something because he's got that distance to travel.
Well, and the other thing I must say, in full disclosure, I was over there last Wednesday checking the facility out, and the people that were using the hyperbarics, and you have quite an inventory of hyperbaric equipment, you had a substantial crowd of folks. I'm not sure that's the right terminology, but a lot of folks mm-hmm. were using the hyperbaric equipment, and I'm guessing they wouldn't be in there if it wasn't some sort of effectiveness for them.
Correct. Right. It's kind of the proof's in the pudding, and they keep coming back because they see improvement.
Yeah.
So,
well, very good. All right. So how do people find you again?
Yeah, 712-339-6024. You can call us as well if you want more information on the integrative direct primary care. Our team would be happy to answer those questions if you can't make it to the event on Thursday night. As well, you can come in to sign up at the front desk if you want to do that as well. So,
and that would be from 5 to 7 tomorrow night.
Correct.
All right. And again, The facility is just north of Fix Ace Hardware in Spirit Lake.
Yes.
Dr. Meyer, thank you.
Thanks, Dave.
Dr. Bradley Meyer, Okoboji Wellness Clinic, with us this morning, giving us once again some hope.